Thank you very much, Mr. President. There are two things that Americans need to know about this Republican health care plan. The first is that it's going to make insurance more expensive. And the second is that it's going to make it harder to get health care in the first place. That is the bottom line of this bill: higher costs for less care, and all for a tax cut for the rich. That's what we're doing. We're taking about $800 billion worth of revenue, eviscerating it, eliminating it, and those tax revenues were basically tax increases that were passed under the Affordable Care Act that were tax increases on the wealthiest among us. So what we're doing is we're getting rid of all of those tax increases in order to cut Medicaid. That's what this bill does. That is not what Americans had in mind when they say, on a bipartisan basis, on a majority basis, when they ask Congress to fix health care. And once you read the fine print, it gets worse every moment. You realize how bad this plan is. The Senate version did something extraordinary. It actually moved to the right. And that is a real legislative achievement. Look at Medicaid. This is a program that helps 1 out of every 5 Americans, 2 out of every 5 children in the United States. It helps 1 out of every 2 families that has a newborn baby. And it covers 3 out of every 4 long-term nursing home residents. This program literally saves lives. Nursing home patients, people struggling with opioid addiction, or people who are working 2 jobs but still don't make enough to cover their own health care insurance. But with this bill, Medicaid as we know it will be destroyed, and also that people at the top of the food chain can pay less in taxes. This bill actually has a certain symmetry to it. There's at least $800 billion worth of cuts to Medicaid, probably more, but at least $800 billion, and it just so happens that there is also around $800 billion worth of tax cuts for the wealthy. So insurance executives will be okay. Don't worry about them. What we should worry about is women who need Medicaid for maternal health services. We should worry about seniors and people with disabilities. And activists for disability rights are appropriately freaked out about this bill. People in wheelchairs protested outside of a Senate office earlier today, and some of them said that they will literally die if this bill passes. It was an intense protest, and we hope that everybody is okay. But it's intense because these are intense issues. These are personal issues. These are healthcare issues. People are worried not about some abstract public policy or political debate. They're worried about their own lives. And they're not wrong. Because of Medicaid, people now have access to physical therapy and immunizations. They can see a counselor for mental health problems and opioid addiction. They can afford the medication they need instead of relying on free samples from clinics. Medicaid has changed everything for them. And this is not just good for patients, it's also good for taxpayers. By giving preventative care, we save money. And if Trump Care becomes law, those services will go away, thanks to $800 billion in cuts. This bill also lets insurance companies opt out of covering essential health benefits, and I want to be really clear about this. So this is a term of art. It's a piece of jargon, so I'm going to kind of go slow here and not assume that if you're not in politics that you would understand what an essential health benefit is. But basically, there are 10 things that if you're getting a health care plan under the federal law, that a health care plan has to cover. It kind of makes sense. And I'll just list them: ambulatory patient services, emergency services, so an ER visit, hospitalization. If you have to stay overnight in the hospital, it has to be covered in your health care plan. Maternity and newborn care, mental health and substance abuse services, including behavioral health treatment, prescription drugs, rehab, laboratory services, preventative wellness and wellness services, chronic disease management, and pediatric services. So I want you to imagine a world where you can get an insurance plan, a so-called insurance plan, but they can tell you under the law, oh, by the way, we don't cover hospitalization. By the way, we got this great insurance plan, but if you need any prescription drugs, that's out of pocket. Not a copay, you got to pay all of it. By the way, we'll give you an insurance plan, but if you have mental illness, you're on your own. By the way, if you get pregnant, we don't cover that. Weird healthcare plan, wouldn't that be? Which is why we have a statute. We have a federal law that says ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse services, prescription drugs, rehab, lab services, preventative and wellness services, and pediatric services. You gotta cover that. Otherwise, it's not insurance. Every one of these benefits is covered full stop under the current law. But what the proposal does is essentially eviscerates essential health benefits. So I don't know what the CBO is going to say because they've got rid of the individual mandate and it's going to be unclear, but there's a real possibility that they will actually have an increase in the number of people who are covered, but that coverage is going to be nonsense. Can you imagine having a health insurance plan that doesn't cover maternity care? Can you imagine having, especially nowadays, when half the time when you go into the doctor, they give you a prescription. So you go into the doctor and they say, you need this, and you say, okay, and then you got to pay out of pocket. What's the point of insurance if none of the things that you need are covered by the insurance? And that's what this bill does. I'm also worried about the distractions in this bill. It defunds Planned Parenthood and doesn't provide nearly enough for opioid addiction programs. And I want to be clear about what I mean by distraction. It is my supposition, I don't know for sure, that these things are intentionally either omitted from the bill or put in the bill to allow some of my Republican colleagues to get well legislatively. So what do I mean by that? Opioid treatment was tens of billions of dollars in the House version. They brought it down to I think less than $1 billion. And that puts somebody on this side of the aisle in a position to say, even though I'm for $800 billion of Medicaid cuts, which will eviscerate opioid treatment across the country, I'm going to introduce an amendment and we're going to increase opioid treatment. And then once we get a yes vote, well, I was really concerned, but with my amendment, we've got more money for opioid treatment. Don't fall for that trick. Don't fall for that trick. It is a trick. The way to fund opioid treatment is to fund opioid treatment. Medicaid is both the clinical way, the best way to do it clinically and the best way to do it fiscally. So I am afraid that they intentionally left that out so that somebody could go in and be the hero on the other side while not actually solving the problem. Likewise with Planned Parenthood. The way you fund the opioid treatment is through Medicaid. You had 13 men working in secret without input from any women or Democrats or experts or advocates. I mean, part of the thing about health care, right, as the president says, is nobody knew it was so complicated. But you really need hearings. You really need to understand how all of these parts of a system interact with each other. Let me give you an example. You cut Medicaid, and somebody who's Medicaid eligible, but also a veteran, you don't know for sure whether if Medicaid services are not available, if they're going to go back into the VA system and cost the VA system more money. You don't know if you cut preventative treatment, if you're going to end up having to pay on the back end with more ER services. And so the reason you have hearings is you have to have some rather technical expertise in the room to say, hey, if you do this, this might happen. If you do that, this might happen. If you do this, we're not quite sure what might happen. But the idea that 13 men with very little expertise in healthcare policy, they're not unintelligent, they're not unqualified to be public policymakers, but the whole thing about being in the Senate is, for the most part, we're supposed to be, as they say, Jack or Jane, Jack of all trades, master of none. We're supposed to be pretty good at receiving information, kind of distilling it, asking the right kinds of questions, listening to our constituents, and then crystallizing all of that into a bill. The problem with this process is they did about a third of that. They talked to each other, and they talked to Republican lobbyists. But they didn't talk to the people back home. They didn't talk to people who run community health centers. They didn't talk to mental health advocates. They didn't talk, and we have people that come from Hawaii and across the country that advocate for every specific disease treatment and disease research. And these people usually are touched personally by their issues. And they come in, and many of us, most of us, receive them and talk to them and think about how to get them more funding or more reimbursements through NIH or CDC or the Department of Defense or wherever we can find resources for them. That's the process of being in a legislative context if you're not personally an expert on healthcare policy. And if you do it in the dark of night, if you do it literally without any women, if you do it literally without any people from the other party, you're going to get a bad product. And they knew they were going to get a bad product, but they made a judgment. They made a judgment. They decided that the longer that this bill sees the light of day, the lower the chances it has of passing. And I think they're right. I mean, if this thing is subjected to real sunshine, it will just wither. I mean, that's just a fact. This is why they didn't have any hearings in the House. This is why they're not only not having any hearings in the Senate, but they're going to allow for, I think it's 20 hours of debate under this silly vote-a-rama procedure. And what they will do is, I think, yield back a lot of their time. What does that mean? That means 20 hours will become 10 hours. Because they don't want to defend their bill. They are absolutely happy to trash the Affordable Care Act and say that it's got a series of problems and all the rest of it. And you know what? The Affordable Care Act has a series of problems, no doubt about it. I will tell you, it is way better than this. I will also tell you it's way better than the situation we had before the act was passed. The number one cause of bankruptcy in the United States was getting sick. Think about that before this act. That people would be not just afraid for their self when they got sick, when something catastrophic happened to them, either a chronic disease or something that imperiled their lives or an accident, that you'd have dual anxieties, right? You wonder whether you're going to be okay, but you also wonder whether or not you're going to be able to make it financially. And so we're sort of beyond that. And now we have a law that's been on the books that does need fixing. And I know the presiding officer and the senator from Missouri who's waiting to speak would be pleased, really would be pleased to participate in a bipartisan process. And I think about the chairman of the Health, Education, Labor, and Pensions Committee, one of the best statesmen in the United States Senate, Lamar Alexander, Republican with whom I disagree on a lot. But he and Patty Murray did a bill on public education that got, 84 votes or something. Liberal Patty Murray and conservative Lamar Alexander did a deal. Orrin Hatch, President pro tem of the Senate, someone who worked with my predecessor, who worked with Teddy Kennedy, who did bills and did deals. And so I understand we're kind of in this squabble about whether or not there is good faith, or there was good faith, right? Our view of this is you went into the reconciliation process before even in any serious way pursuing bipartisan legislation. You decided you wanted 51 votes, not 60 votes, and that was sort of a poisonous fruit from the tree. Fine, that's our view. Your view is that you've serially tried to reach out to us and we have rebuffed your overtures. I have my view, the Republicans have their view. But right now, you're about to walk 1/6 of the American economy off the cliff. And you're also about to harm tens of millions of individuals in all of our home states. Not Republicans or Democrats or Greens or Independents or Libertarians or people who don't vote or whatever it may be, but people are going to really be hurt by this bill. People are going to really be hurt by this bill. And forgetting the politics, I think we have an opportunity to avert the harm. And if this bill does come crashing down, then I think we have an opportunity to work together on health care. And I, for one, pledge that if we're in a position to sit down on a bipartisan basis and come up with improvements to the existing statute, I will be the first person to say yes to that kind of process. It's not too late. All we need is 3 Republicans to say, let's slow down, let's have a hearing, let's work with Democrats, let's do this the right way. I yield the floor.